Good morning. Thank you very much, Dr. Tushmit. This morning, I'm going to briefly showcase for you 3 new connected health initiatives from the Preventive Care Program in my office. These are the Healthy Living Assessment, an HRA, the Veterans Health Library, and Move Coach, the latest version of our Move Weight Management Program for veterans. All 3 of these are still under development, although you can do a test run of some early versions of them at the table over here to my left. So I don't have any great videos to show you yet, but those will be coming soon, and I'm excited about that. We think these new resources are really key components of VHA's transformation to personalized, proactive, and I would add preventive care that will help keep veterans well and healthy for the long run. I'm going to start by describing to you the Healthy Living Assessment. As I mentioned, this is a health risk assessment, or an HRA, and many of you may have seen HRAs in the past. You may have had the opportunity to complete one from your employer or your insurance company, and typically they're paper and pencil tools, standard set of questions. Everybody gets the same questions, and you mark your answers, and often that's the end of it. This is a much improved way of doing that, and because it's computerized online, it can customize the questions that are presented to the user based on their previous answers. So no one user gets exactly the same HRA because it depends on what you said earlier. So it's very customizable and very tailored to each user. At the completion, once you go through all the questions, the user is presented with a report that provides a personalized list of doable actions. Based on what you said in your HRA, here are some things you can do to improve your health. And it allows the user to say, well, what if I did this? How would that improve my health? What if I did those other things that I've been thinking about? What would I get by doing that? So it really is a very interactive and dynamic report. And I'll show you some screenshots, and you'll be able to play with it if you'd like. And then there's an option to share that report with your healthcare team. We don't want to automatically share it because we want the user, the veteran, to feel like this is his or her personal information. And if he or she doesn't wish to share it, that's okay. But we think that by sharing it with your team, that really gives you a chance to dialogue with your provider and help develop your plan for how you can continue to improve your health. The tool that we've developed is very much in line with a couple of external standards that we think are important. As you may know, the Affordable Care Act requires an HRA to be part of the annual wellness visit in Medicare. That then helps inform the development of a personalized prevention plan. So this is very consistent with the ACA requirements. It also helps us to meet the meaningful use standards that are required from a previous act. The Healthy Living Assessment contains questions in a variety of different areas, the questions that you see, the content areas that you see here. And as you can see, these are things that mostly only the veteran knows about him or herself. These are personal things that we often don't ask, certainly not routinely and standardly, of all of our veterans when we see them in clinic. And we know from literature and previous use that sometimes all of us are a little more inclined to answer more honestly questions if it's putting that information into a computer than if we're having to admit something to somebody face to face. So this is a very nice way of collecting some sensitive information that we don't, but that we may not feel comfortable doing. We licensed the content of a commercially available tool, an HRA, and then modified it extensively so that it's consistent with our clinical policies and procedures and terminology. The tool that we purchased, licensed, came from the UK, and for example, it asked about weight in stones. Now, I don't know how many of you know what your weight in stones is. I don't know what that is for me, so we had to translate that into American English. We also added some content that wasn't in this commercially available product that's particularly veteran appropriate. Ask questions about traumatic brain injury and so on, as you see there. And that will really give us an opportunity to, again, routinely collect that information. We've made sure that it has several questions that are specifically for women's health, as you see here. So to show you how this really looks, let me walk you through this with Sharon. Sharon's a veteran who is a little concerned about her health. She's 55 and says that she thinks she needs to start taking better care of herself. She doesn't have a computer at home, so she goes to her local library and sits down at the computer, goes to the My Healthy Vet website, and clicks on what will be a link to the HRA when it's there. She'll first come to a welcome page. Now, this is a little boring looking, and this is still in development, so we'll make it look a little more interesting when we get the final one done. But there are a couple things I want to point out here. One is that you'll notice on the upper right, her name is there. So this tool is personalized to her. The assessment realizes this is Sharon, and she's the one taking it. You'll also notice the point that I made earlier, that this report is private, and it's for her. If she chooses to share it, which we hope she will, that would be great, but she doesn't have to. This is her own report. So I don't have time to go through the whole thing, so let me just show you a couple of the questions that will show up, and just to use these as examples. So the first thing you notice, again, her name is there. There's a bar at the bottom that gives her a sense of how far she's gone, how much she has to go yet, so that helps keep her tracked with completing it. This particular question is one about traumatic brain injury. It's the first of 4 questions that will be available. And the items, the questions that we use have all been validated in research so that we know that we're using the wording and the way of asking the questions that works best to identify the information that we want. Here's another question. This one happens to be about depression, and this is in what is referred to as a table format. As already mentioned, many of our veterans use assistive technologies like screen readers for computer pages, and we've been very careful to be sure that the way these questions are presented works very well with those kinds of assistive technologies. More things falling down. You'll notice this is a question about depression, and if she answers that she has been bothered by these symptoms frequently, she'll get further questions that ask more about her symptoms of depression. One of the questions actually even asks if she's ever thought about hurting herself. And if she responds positively to that, the number for the Veterans Crisis Line will immediately show up. So right then, she'll get information that will help her say, gee, maybe I should reach out to someone. And so the Veterans Crisis Line number will show up right then. It'll also show up again at the end of the assessment when she's getting her summary report. Just a reminder, you said that you were thinking about this. Here's where you can get help. So that's built right in. This is the last question that she'll see, and this is one that allows her to say whether she's interested in working on any of the areas that might be appropriate for her, so she can check as few or as many as she would like. She'll then come to this summary page, and this is what's really compelling about this particular product. We think this is a really great tool. You'll notice in the upper left, it gives her health age. Now that's a calculation based on the responses that she's put into all of the questions previously. It's summarized in a concept that we're all really familiar with, what our age is. So it's a summary way of saying to her, gee, your health age is actually, remember, she was 55. She's 11 years older for her health based on the things that she put into the assessment. So, that probably will get her attention and help her think about what she might want to do to improve that. There's some encouragement there already. It says you can reduce this by 15 years with a little eye icon that she could click on that and get more information. If her health age came out lower than 55, or someone else's came out lower than their chronologic age, that means that person's in really good health and doing really great things. So we'd want to encourage them to keep that up. Right under that health age is this list of recommendations. So again, these are based on things that she said that she was doing, and if she were to check any of those, it would make some changes in her calculated health age, and I'll show you that in a minute. in the lower right is a list of several common diseases that she might be at risk for. The dark blue portion of the graph at the bottom is the risk that she can't change by virtue of her age or her gender or her family history, for example. But the light blue bars show the risk that she can change. So you notice her risk for diabetes by the age of 80 is really quite high. It's almost 100%. At the top is a list of screening tests and immunizations that she's due for, again, based on the responses that she put in. So if she's interested in those or wants more information, she can get that right on the little eye icon. And then this portion of the report shows how she rates on these different health behaviors: diet, stress, physical activity, and so on. And you can see those slider bars are in various parts, so various locations. So her diet right now scores pretty low. Her physical activity is kind of in the moderate range, and her tobacco is at the top. If she wants more information, she can click on the section here, and these are things that she can talk with her provider and her healthcare team about if she would like. And then finally, we don't want to just give her all bad news or talk about all the things that are going wrong. We want to say, gee, there's some things you're doing well, and here's what those are. So as I mentioned, with this tool, veterans can try out some what ifs. What if I were to do this one? What if I were to change that? How would that matter? And see how much that would improve my health. So Sharon checks this first couple of boxes, lower blood pressure and lose some weight. And then she clicks on recalculate. And now you can see her health age has come all the way down to 57. So those two things make a substantial improvement in her health, and she can see that. She can also see, let me go back, she can also see that her risk for diabetes has dropped quite a bit, and so that's a real positive, motivating kind of response. As I mentioned, we'll encourage veterans to share their feedback report with their team to help them become more actively involved in shared decision-making and creating their personal prevention plans. It's still in development, as I mentioned. We'll be doing some more user testing with veterans this spring and summer, and we'll be pilot testing it in facilities in the fall, and anticipate that it'll be ready for public launch a year from now. The second tool I want to briefly mention is the Veterans Health Library. This is another tool that will be part of My Healthy Vet. So again, another place to go to there that will feature a comprehensive veteran-focused health information. The content is all, again, we purchased a commercial product from a vendor of health education information, and then had everything thoroughly reviewed by VA subject matter experts to make sure that it was the correct information, consistent with our policies and procedures, and was what we want veterans to hear. It's been extensively field tested, and we anticipate launching it really in a couple of months, certainly by the end of third quarter of this year. And then we're going to work to integrate it into our electronic records so that as staff are talking with patients about health education, they can very easily document that in the record, and that meets Joint Commission and meaningful use requirements. So here's a screenshot of the opening page. You'll notice on the left is a list of the major areas that can be covered. In the center, the featured content, and then more resources on the right-hand side. So let me quickly show you. If you clicked on the diseases and condition, you'll see a long list of the kinds of topics that are included in the library. And you can pick any one of those and get much more information. So here's an example of a health sheet on diabetes and the benefits of exercise. There are over 3,000 health sheets in the library, half in English and half in Spanish, so it's very much accessible by our Spanish-speaking veterans and their family members and caregivers. You notice on the right, there's Learn More that's very much related to this same topic, so veterans can explore this kind of information to a great, to the depth that they're interested in it. Under Veterans Resources are links to more VA-specific content, and some of those links go directly to the program offices own website so that they keep up their content on their website, and then it's directly linked into the library. That way they don't have to try to keep up content in two different places. And it provides the users with the latest, most current information. Other clinical program offices embedded their content directly into the library. So here's a field manual for foot health, which is very consistent with the way that veterans are used to seeing field manuals in practice and in their service, and provides a great deal of information. There are a number of videos, more than about 250 videos that are part of the library. Again, most in English, some in Spanish as well, cover a wide variety of topics. In addition, there's some online guides that are called flipbooks or go-to guides, and you can see how they work. So another interesting, engaging way to present a lot of information. So in summary, the Veterans Health Library, again, which you can try out over here, provides information that's tailored to veterans, that can be trusted by veterans and their family members and by staff. And as I mentioned, it'll be coming out yet this year, in a few months. Finally, I want to just quickly mention our third tool that we're featuring, and that's Move Coach. As you may know, Move program, weight management program for veterans is our comprehensive weight management program that we have available in every facility for individual or face-to-face encounters. We have it available by telephone and by telehealth. And now this is the latest version of Move, which is a web-based application, both for web and for mobile applications. You'll hear soon about the suite of VA mobile applications, and this will be one of those when it gets finished. All of our Move content focuses on goal setting and self-monitoring around physical activity and diet and behavior changes. Includes problem solving. When you're having trouble with losing weight, what are some of the things you might need help with? Includes self-management guides, and the web and mobile-based versions will interact with our VA clinicians, and so they'll be able to help coach the user through their weight management issues. So this is what the mobile app looks like. We started with developing the mobile app first, and then we'll develop the web-based version a little bit later. And this is what it looks like when you download it, or when you will be able to download it. You notice once you click on the Move Coach and open it up, you'll see a link to self-management guides. We've used these very successfully in telephone-based Move Care, and so have converted that to the web-based version. Problem solving, as I mentioned, and being able to track goals and progress. That portion at the bottom will show graphs based on veteran entered data. So the more data you enter, the more graphs and visualization you'll see of that. So if you were to click on the self-management guides, I would see this screenshot on the left. There are actually 11 of them, 9 of them show up here. And then if you were to click that first one, Getting Started, you would go to this page. And this is similar for all of the different self-management guides. There's a goals section, a homework section, and then a list of chapters. And this is a comprehensive program that a veteran user would work through over a 19-week period. So it's different from just the commercial web weight management apps that you often find, which provide some information, but this is a set program of care that the user would work through. Here's some screenshots in Chapter 1, Getting Started, and the one on the left and the one on the center are short little video clips. It's much more interesting to watch a short video clip and get the information than it is just to try to read small text on a little smartphone. So we've embedded a lot of videos to make it interesting and easier to get information. We've incorporated a number of games, again, to make it fun and engaging. So this asks about comparing serving size to common objects, and this user got the right answer. That was great. There's a number of ways of setting goals. Some are text-based, so a little short entry. Some are numeric and provide easy ways of doing all of that. We have done some initial user testing with veterans, and they found this to be very engaging and useful, and would certainly recommend it to others. more guidance at the end of summary reports, where you are now, what your goal is, and how close you are to achieving that goal. Oops. There was one more slide there. So as a result of these interesting and engaging new technologies, we think that they will go a long way to helping veterans stay healthy for the long run and make good health choices. Thank you.